Okay, I'm going to go ahead and call to order this meeting of the First Five Sacramento Commission for December 7th, 2020. Madam Clerk, will you please call the roll and establish quorum?
Commissioner Cerna.
Here.
Commissioner Sneeringer.
Here.
Commissioner Fernandez y Garcia.
Here.
Commissioner Gordon.
Here.
Dr. Cassiere is out today. We got an email from her. Commissioner Wagstaff. Bruce? Oh, I see him. Commissioner Wirtz?
Here.
Commissioner Kennedy?
Here.
Got it. Commissioner Hassett?
Here.
Commissioner Turner Johnson?
Here.
Commissioner Evans?
Here.
Commissioner Cossack?
Here.
Commissioner Porter?
Here.
And Commissioner Moak?
Here.
Okay, Dr. Cassiere is out, so Kathy Cossack will be voting in her place. And other than that, we have a quorum.
All right. If you could please display the visual of the flag, we'll do the pledge. All right, hand over heart. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, very good. Okay, again, I want to welcome everyone to today's First Five Commission. It's the last one for 2020. There's going to be all kinds of jokes about 2020 forever, I think. But with that, I do want to go over some rules because we are obviously meeting remotely. We have rules for commissioners, and then we have the public rules. So I'll go ahead and start with the rules for our commissioners. Commissioners will be unmuted upon entering the Zoom meeting, and I ask that you mute your phones until you are called on to speak. Commissioners are encouraged to make comments and ask questions of staff throughout the meeting. Please use your raise hand button under participants when you would like to speak, and I will call on you in order. Please lower your raised hand after you have been called on. Commissioners may see some questions pop up in the Q&A section. Please allow staff to answer those questions as they will primarily be related to making public comment. And then for the public, we have separate rules. Members of the public entering the Zoom meeting will have the ability to signal that they would like to make a comment on any agenda item throughout the meeting. To be placed on the speakers list for any item, please click on the Q&A button and write your name and indicate the agenda item you wish to speak on. Please type into the Q&A at the beginning of the meeting or as soon as you know you would like to comment so that staff have time to create the speakers list. We will call your name in the order it was received and unmute you when it's your time to speak. The public calling in through the phone line will also have an opportunity to address the commission. If you have something to say when the phone line is unmuted, please state your name, the agenda item you wish to address, and then your comment. Public comment in the Zoom meeting or over the phone is limited to 3 minutes. For commissioners and our public, please unmute yourself when called on to speak, and then mute yourself again when you are done speaking. And I believe with that, we are ready to go into our consent matters.
Sorry, just one more thing. I need to read my replay statement.
Okay.
This meeting of the First Five Sacramento Commission is cablecast live on Metro 14 Cable, the local government affairs channel on the Comcast Consolidated Communications and AT&T Uverse cable systems.
I'm not sure what this Zoom
This
call.
meeting is-
Am I muted by them?
This meeting is closed
Your
caption.
mute is over there on the bottom left. I know.
This meeting is closed caption and
I
live
can't hear
streamed on
anybody.
Metro 14 live at saccounty.net. Today's meeting
You
will
got
be
this
repeated Wednesday,
red
December
thing right
9th
there?
at 2 p.m.
I don't know if anybody's talking.
Hey, Bruce, we can hear you.
Is your, so go exit at the top where it says exit on the right. It says exit full.
It'll be repeated Wednesday, December 9th and Saturday, December 12th at 2 p.m. on Channel 14.
Scott, you're getting way too much of a kick out of this. All right. Okay, now we'll move on to consent.
Now we'll move on to consent. Item number 1, approval of November 3rd, 2020 draft action summary.
Okay, does any member of the commission wish to make any changes? If not, entertain a motion.
So
I'll
move.
move approval.
It was moved by Commissioner Kosick. Who was the seconder?
I could second.
The
Steve.
second by Commissioner Wirtz. Let's go ahead and do a roll call.
You got it. Commissioner Cerna,
Aye.
Commissioner Seringer,
Yes. Aye.
Commissioner Fernandez y Garcia,
Aye.
Commissioner Gordon,
Abstain.
Commissioner Kosick,
Aye.
Commissioner Wagstaff,
Aye.
Commissioner Wirtz.
Aye.
Motion passes.
All right, very good. On to separate matters then.
Oh. Item number 2, public comments on off agenda items.
Okay, Carmen, do we have anyone signed up to speak?
We do not have anybody signed up to speak. We have one caller. I'm going to allow them to talk right now. They can unmute themselves if they wish to address the commission. Caller, you're now able to address the commission should you want to. Just unmute yourself.
Phone number ending in 1906. I assume you do not wish to address the commission on items not on the agenda. We don't hear anything. Okay, let's move on.
Item number 3, executive director's report.
Good afternoon, everyone. Sorry for the rocky start again. One of these days we'll get it right. Just in time to go back to in person, probably. A couple of things from the executive director's report to touch on. The first is that the association developed a memo and shared with the Biden-Harris transition team a set of recommendations based on feedback and experiences of young children and families from across the state. The recommendations span everything from early learning to health and development, family resiliency, and really emphasizes the needs for all of those systems at the federal level to work together to be coordinated for children and families. They made recommendations around expanding childcare, healthcare stabilization, and promotion of preventive community-based services and care. And it also recommends an expansion of home visiting services and the Paid Family Leave Act. So lots of good stuff. And I can send you, I'll share that transition memo with you all after the meeting today. As for a state budget update, while the LAO's office did in fact report a surplus of $26 billion to begin in fiscal year 21-22, it also revealed an operating deficit in the next 3 fiscal years after that. So we simply don't know what the outlook, the economic outlook for kids and families will be, and we do continue to wait to hear more about our federal stimulus, any federal stimulus funding for state and local relief. One indication of support for young children in California was brought to light with the governor's early learning master plan for early learning and care that was just released last week. And the master plan highlights statewide paid family leave and childcare and early learning for workforce development. It also expands free preschool for 3-year-olds who are living in poverty, and talks about preschool for all 4-year-olds in the state. It is costly, however, anywhere from $2 billion to $12 billion a year. And there really isn't a mention in there about how that might be paid for. So we see it as a starting point where some things were put into writing around prioritizing young children. But I think it remains to be seen how it might actually be implemented. Commissioner Sneeringer was actually appointed to the Early Childhood Policy Council that provided input to the governor's team on this. And I don't know, Donna, if you have thoughts from the inside or what this might look like for children and families on the ground.
So the Early Childhood Policy Council did have the opportunity to provide input into the development of the document this summer. We didn't see much of it before it was released, just a high-level overview. So I think we are looking forward to our next meeting, which is actually this Thursday, to learn a little bit more. I know many of the proposals are things a lot of us have worked on for years. There wasn't a whole lot that was new, and it really comes down to how to pay for it, which is typically our issue. So the $2 to $12 billion estimate is pretty wide range, but it's also significantly lower than other estimates we've seen for similar proposals. So I think we're just all trying to get our heads around what would be the sequencing of these types of proposals. How do you start to roll out these types of changes while doing no harm and building a better system for children and families? And the Early Childhood Policy Council will continue to meet. My appointment is for 3 years, so we have lots to discuss over the next few years. And I think the master plan itself did state that it is the beginning of a conversation, and I'm happy to keep the commission updated.
Thank you for that. In other news, we are working in partnership with First 5 California. They have made a one-time purchase of books to get a book into more children's homes. And so we will be distributing 7,000 packets of books, 3 books in each packet. We're working with SCOE to get that. They've been so generous, giving us warehouse space and helping to distribute the books when they arrive. And also a shout out to Commissioner Fernandez y Garcia. He is going to get them into the pediatric offices at UC Davis Health, as well as help us connect to the FQHCs and get them out through there. So that's exciting. We love when First 5 California purchases things that we can then distribute on our end. It's a win-win for sure. In my report, I won't go through the whole thing, but I did provide you with a more extensive dental update on our oral health services and partnerships. And one of the highlights in there is that just this month, they're flipping the switch and turning on fluoridation for the Arden Arcade community. This seems like a really long time ago that we came to you to approve this, almost 2 or 2.5 years ago. And it is starting like right now. So I feel like I would channel Dr. Jones right now to say that this one-time investment by the commission will serve the children and families in Arden Arcade for a minimum of 20 years. That's some real systems change going on right there, and something that I think he is just very proud of in his last couple of months on the commission doing. And then finally, in other news, we are, First 5 is partnering with the Department of Child, Family, and Adult Services as they develop a children's system of care plan for Sacramento County. And the goal of that plan is to ensure that our county's most vulnerable children and their caregivers kind of have a seamless system of support. Many of these are kids who are already in the child welfare system, but I think that the particular lens that First 5 brings to it is that prevention lens and the family strengthening resources to make that plan even a stronger plan. running sort of the whole prevention through intervention continuum. So I'm really happy that we're a part of that work group, and will be a signatory on the plan and the MOU. So that's great news. And then the last thing is, as you know, with our strategic planning process, we are in the throes of the RFP season. So we are distributing nearly $40 million for 3-year contracts that will begin in 2021, 22. And so with that, we have distributed all those RFPs. We've held bidders conferences. We've recruited review panel members for each of the proposals and RFPs. And so we are just working through that right now. And we will be bringing you all recommendations for approval beginning in February next year. And that concludes my executive director's report.
Great, thanks, Julie. Any questions from commissioners? Okay, Carmen, do we have anyone signed up to address the ED report?
We do not have anybody signed up. We do have one caller that I will allow to speak in case they would like to address the commission. Any public comment? No public comment.
Okay, very good. Thank you. All right, next item, please.
Item number 4, advisory committee update. Appoint Pooja Midal to the immigrant population seat. Sorry if I messed up your name.
Okay. I don't think that Bob Silva is joining us today. I didn't hear back from him, so I can just give a quick update and then ask for your approval. We had back-to-back advisory committee meetings over the last 2 months, and the committee members have been just super generous with their time. More than half of them are sitting on review panels of our multiple review panels, some of them on multiple panels as well. We've been keeping them very busy, and so we're super appreciative of their service. At our November meeting, the members heard a preview of the presentation that you'll be getting later on in this meeting on our efforts to reduce African American child death. As always, they provide us some good feedback to include. And then additionally, we have a new applicant to join the advisory committee. Dr. Pooja Mittal is a family practice physician. She currently works with HealthNet right now, and she's focusing on social determinants of health and African American maternity and infant equity issues. She is applying for our immigrant populations open seat, and her application can be found in your packets. I recommend appointing Dr. Mittal to our committee.
All right, very good. Carmen, anyone sign up to speak on this issue?
Nobody has signed up to speak on that issue. We do have one caller. Caller, you're now able to address the commission. No public comment.
Okay. Carmen, I'm wondering if there's a way you can, in the chat box, ask that caller what item they do want to speak to, or if they want to speak to any at all, so that we don't have to check each time.
Sure.
Okay, we do need to take a vote on the appointment of Pooja Mittal as the immigrant, to fill the immigrant population seat. So I'd entertain a motion at this point.
I move approval of Pooja Mittal to the immigrant population seat on the advisory committee.
Okay, it's been moved by Commissioner Steringer. Is there a second?
I'll second.
Second by Commissioner Kosick. Roll call vote, please.
Chair Cerna.
Aye.
Commissioner Steringer.
Aye.
Commissioner Fernandez y Garcia.
Aye.
Commissioner Gordon.
Aye.
Commissioner Kosick. Commissioner Wagstaff,
Aye.
Commissioner Wirtz,
Aye.
motion passes.
Great, thank you. Next item, please.
Next item, item number 5, evaluation committee update.
Yes, I can be fairly short this month. We did not hold a meeting this month. We had our meeting in October and did editing on the Reducing African American Child Death draft report during that time as well. So we'll hear about that later in the agenda. And additionally, we're changing, and Carmen, you can correct me if this is not permanent yet, but the plan, I believe, is to move our January meeting to January 11th at 1 p.m. because of the holiday. And so thank you, Carmen. And so that's it. A short report this time.
Very good. All right. If there's no questions for Commissioner Wirtz, we'll move on to the next item, please.
Item number 6, financial planning committee update.
I could be even shorter. We did not meet since our last commission meeting. We'll be meeting in January.
All right, very good, thank you. And next item.
Item number 7, sustainability committee update.
Well, now I feel the pressure to be short. We did meet on November 20th. We discussed policy updates, and Julie covered in the executive director report the release of the early learning and care master plan. The bulk of our meeting was discussing systems improvement and sustainability activities, including a potential committee name change. So stay tuned to hear our new name. And we decided that we needed to roll up our sleeves and do some significant work with staff on the racial equity, diversity, and inclusion resolution. And we are going to be having an additional special meeting in January to work with staff to make sure we can put together a resolution that we can bring back to the commission in February. So that was the bulk of our conversation, and we look forward to bringing that back to you at our next meeting.
Terrific, thank you. Any questions for Commissioner Sneeringer? If not, we'll move on to the next item.
Okay, item number 8. Sorry, hold on. I have the wrong agenda. Item number 8 is present a women's commission approval.
Help you
Sorry,
out.
I don't have my updated. Thanks, Julie.
Wrong subject.
I can help you out. This is item number 8 is to approve first 5 support for the Sacramento County Board of Supervisors enactment of a women's commission.
There you go.
That's it.
Yes, okay. So tomorrow, the Board of Supervisors will receive a report from an interim Sacramento County's Women's Commission. The the report of recommendations comes after about 18 months of deep and meaningful dialogue with diverse women from throughout the county. The group will ask the supervisors to formally establish the Women's Commission, which would then report to the board on all issues related to women and girls. There's much intersectionality between the Women's Commission and the Children and Families Commission, as you can imagine, which would make both of our missions more achievable. Staff recommends that first 5 show support for the Board of Supervisors enactment of a Women's Commission, and that we send a formal letter of support to the board immediately following this meeting.
Great. I know Ms. Berry's here, and she may want to speak to this, and then we can certainly entertain questions about it. This is a blue ribbon commission that I established working with Aaron about a year ago to get it going. This is just to be clear, it's a proposed commission on the status of women and girls for Sacramento County. And in my briefing with our executive director, I had suggested that this be brought before this commission in anticipation of the board's hearing to consider establishing a permanent commission tomorrow at tomorrow's board meeting. And as Julie mentioned, I thought it would be very relevant since much of the charge and mission of First Five, I think, has a great deal to do with certainly women, mothers, and young women and girls. So I thought we could hear a little bit from Erin very briefly, maybe explain some of the work that you've been doing with and the tremendous amount of outreach you've been doing over the last year. If you haven't seen the full report, it's an extremely impressive document. I was very pleased to really see the fruit of the labors of Erin and so many others over the course of the last 12 months. So can we unmute Erin, or Erin, can you unmute yourself?
Sure. Thank you, Supervisor Cernan. I'm here with Dr. Tanya Lindsay, who's our co-chair of our data committee and really has been from the beginning part of this effort. And I also wanted to acknowledge fellow Blue Ribbon Commissioner Beth Hassett, who is on your commission as well. So we have some connections, and Donna Sneeringer, who was at our forum speaking. So nice to see you all. And thank you, Supervisor Cerna, for your support and this opportunity to have this Blue Ribbon Commission exploration. We, as the supervisor said, we have submitted our report to the board with a recommendation for an immediate establishment of a commission on the status of women and girls. And I'm delighted to be here to speak with you. I spent almost a decade, as Scott Moak knows, doing child welfare reform statewide, but as part of a national foundation where we were part of the early research with the University of Washington into early childhood development. So this is an issue personally near and dear to my heart. But I think that there's a lot of, one of the things that we've been able to do in the time as a Blue Ribbon and also in our volunteer effort, grassroots effort beforehand, is really to do a lot of engagement in the community. And we've seen the benefits already of the beginnings of just collaborations and bringing people together who have not been together before in the community. And I think that a role that we could play certainly with you all is to think together about how we can help, particularly in these tight budget times. You all have money that comes into you. We won't in the same way, but what we will have is, and we've already built a basis for, is strong connections in the communities of this county and the diverse communities, and particularly looking at issues with women and children together, healthy pregnancies, issues of access to perinatal care. And we were surprised at how much midwifery came up as an issue that women were concerned about, particularly in African-American communities, and access to, of course, childcare came up over and over and over, particularly with the COVID crisis. And I'll defer to Dr. Lindsay in a minute to talk more about our data on that. And then, your work with community connections. I think that we can be a good partner in that. And what we discovered is there's so much great work being done, but to become a clearinghouse and a focal point for a lot of that work, information and access, so that folks will know how to access even some of the great work that you're doing. We had hoped in the beginning before COVID to really be in contact directly with a lot of the family resource centers. La Familia has been, Rachel Rios has been on our committee, and through them, we've been able to benefit from understanding some of the work of Birth and Beyond. But we know that there's a lot more to explore in terms of what kind of connections we can make and support. So I know your time is limited. Everyone else has been really brief, but I wanted to just give Dr. Lindsay a moment, and maybe Beth, if you want to say anything about your experiences on the Blue Ribbon, and Dr. Lindsay can talk a little bit about data, because I think that that's an area where we might want to work with you.
Thanks, Erin.
Hi, this is Tanya Lindsay. Can I go ahead?
Yes, please.
Okay, so I'll make this really quick. I think the one thing that we should definitely share with you is our trials and tribulations with finding good and consistent data where we could find some data about Sacramento County women, for example, that there's around 30% of our households that are headed by single parents, not necessarily women, but single parents. And from there, it gets more and more difficult, as I'm sure some of you know who work with data, to be able to break that down by, say, age or race or ethnicity, so that we could know more, at least even about the demographics of our women and what they need, let alone their employment status or childcare needs. So we're hoping that we can collaborate with you and other commissions and departments within the county in order to get really good, robust data that we can track and measure in order to find out policy areas that where our women and girls need it most. And I think I'll leave it at that.
Very good. Thank you. Beth, did you have anything to share?
Sure. It's been great working on this project and appreciate your support, Supervisor Cerna. I think that some of the best solutions for problems come when you bring multi-sector groups together to look at them from all different angles. And I really feel like this commission has that potential to bring together people, not that we don't all work together in different capacities, but we're not all looking at the same issues through our own filters and bringing those good thoughts to the table. So I'm really hopeful that this continues to move forward. And thank you, Erin, for all your very hard work on this.
Yeah, thank you. Thank you, Tom.
Thank you. Thank you, Erin, especially for your leadership again. Like I said, having a chance to delve into the report, it is something to be very proud of.
Thank you.
So lest anyone think that this is purely novel on behalf of Sacramento County, I assure you it is not. In fact, Erin, correct me if I'm wrong, but I think we're one of only 2 large counties out of the 58 in the state that don't have a women's commission. So there's plenty of precedent. There is, in fact, plenty of history in other counties across the state where these commissions have existed in some cases for decades. So I'm hoping that we'll be able to get it across the line tomorrow at our board hearing. And I think a letter from this commission would go a long way to do that. So with that, if there are no questions or other comments, I'm going to go ahead and move. We do need to vote on this, right? Yeah. So I'm going to go ahead and move the item. And again, the action is to have a letter submitted to the Board of Supervisors in support of the establishment of a commission on the status of women and girls in Sacramento County. Is there a second?
Second.
Okay, I think I heard Commissioner Sneeringer get in there. So we have a motion and a second. Can we get a roll call vote, please?
Chair Cerna.
Aye.
Commissioner Sneeringer.
Aye.
Commissioner Fernandez y Garcia.
Aye.
Commissioner Gordon.
Aye.
Commissioner Cosick.
Aye.
Commissioner Wagstaff.
Aye.
Commissioner Wirtz.
Aye.
Okay, motion passes.
Terrific. Thank you all. And we'll see you tomorrow, Erin.
Yeah, I wanted to just say thank you very much. This means a lot to us and we really appreciate it. And we look forward, once we have a commission, to working closely with you. Carry on the great work. Thank you all.
Great. Thank you again. Next item, please.
Ready for the next one?
Yes, please.
Okay, item number 8, presentation 2019-2020 evaluation findings from efforts to reduce African American child deaths.
Actually, item number 9.
Sorry, number 9.
On the agenda. That's okay. It's going to just take us 1 minute. We are moving everybody who will be speaking throughout the at the end of the presentation or during the presentation into a panelist position so that you can see some faces today. It's one of the benefits of Zoom is that we can actually see each other instead of just hearing voices over the phone. So We will continue to do that right now. Not everybody who you see will be speaking, but they are available. If you all have questions, we might direct that question to one of our community partners in the room. So with that, I will turn it over to Linda Fong Samara. She is our lead on all things related to reducing African American child death at the Commission. And she has a brief, a couple slide PowerPoint before kicking it off to our partners to share the results of last year's data.
Thank you, Julie. If everyone can just bear with me for just another minute, I'm making sure that all of our panelists are, our speakers are moved to panelists, and the computer's fighting with me just a little bit here.
Yeah, no worries.
This is actually very encouraging. I think this is our record number of attendees and panelists for one of our meetings.
Mm-hmm.
Yes, we're moving a good number of people to panelists, and so it's taking a minute for it to cycle through before it lets me click more people. So apologies for keeping you waiting, but we, again, as Julie mentioned, want to make sure you see all of the faces and all of the folks that are involved in doing this important day-to-day work. I'm just about there. I see you, Natalie. I'm trying to move you around. And hopefully you all on the other end are seeing your screen fill up with people.
Mm-hmm.
And these are just some of our partners that are involved in this work. Okay, I think I have most everybody there. I'm going to share screen and get started, and I'll continue to add people as we go. So let me try hitting another button here. And I just have a very brief introduction. Okay, can y'all see my screen there?
Yep.
Great, okay. Again, I'm Linda Fong Samara. I'm the program planner overseeing the health and nutrition contracts, including those focused on the reduction of African American child deaths. Thank you for the opportunity to bring all of our partners together to bring you an annual update on all of these efforts. So just a reminder about the big picture of what's happening in Sacramento County and the background around this work. It is very much based on the collective impact model, which is basically a model that brings together people from multiple sectors across the community to really tackle a complex issue together. And that's the difference, and that's what's working well here in Sacramento County. We all have long-term change in mind with this collective impact model. I'm not going to go over all of the details of what that model looks like, but as you can see on this slide, there are 5 interconnected conditions for collective impact model. And what this does here in Sacramento County is that we have partners from community members to community-based organizations and even systems that are really communicating and working together in ways that they've never been able to as successfully before. So this is really helping us to move the needle in Sacramento County. And in particular, in Sacramento, 2 conditions have been working really well, and that is having that common agenda, which is to reduce African American child deaths by 10 to 20% by 2020, and really having backbone support, which is staff through the Sierra Health Foundation here in Sacramento County. And they've done an amazing job of really coordinating and convening everybody and really keeping the ball rolling here in Sacramento County. So again, this is our collective impact model in Sacramento County, keeps us all focused on that same goal. And it certainly has been very helpful in our specific community. Specific to First 5 Sacramento, we've been involved in this effort since 2012, actually, with participating on the initial Blue Ribbon Commission. We helped develop the charter for the steering committee. And when we look back at our funding when it began in 2013, and when we look forward to what we will be planning to fund through 2024, your commission will have allocated over $17 million to reduce African-American child deaths. And certainly what we fund here through the commission definitely complements and contributes to that overarching community-wide goal of a 10 to 20% reduction in African-American child deaths. It certainly fits within the commission's purview now and our focus on really reducing inequities and doing all of that ready work that we have been talking about for the past couple of months. There are 4 disproportionate causes of African-American child deaths, and our commission specifically focuses on 3 of those top 4 causes of disproportionate death because they impact children ages 0 to 5. And what you'll hear me continue to say over and over again in my presentations, and in the presentations that you'll hear later on today, is we keep stressing partnerships. And that's because partnerships continue to be so key and critical to this work. There is a visual on the side, just a very simple graphic that we tried to put together to represent those partnerships in our community. You have community from residents, associations, organizations and government and largest systems involved. And it's really just to show that while this is certainly not an exhaustive list, it shows that we all are interconnected and we all overlap in our work. And again, we all are very much united in that shared goal in our community. So we're very excited today to come forward with some updates and share some data with you. We're going to start off with a presentation from Applied Survey Research. They are our evaluators here at the Commission, and they're going to give you some updates for fiscal year 1920 specific to our funded programs and the progress that have been made last fiscal year. And then we will have the Sierra Health Foundation present. We'll have Chet Hewitt and Natalie Woods Andrews present as the co-chairs of the steering committee on the reduction of African-American child deaths. And then finally, we will have representatives from some of our funded programs provide some public comment to really give you some additional context to what's happening behind those numbers and the story behind those numbers. So with that, I am going to stop sharing screen. And I would like to invite Jordan from Applied Survey Research to come and present. Thank you.
Thank you so much, Linda. I am just going to share my screen. All right, as Linda said, I am Jordan Kati. I am a project manager with Applied Survey Research, who is the external evaluator for First 5 Sacramento and especially their reduction of African-American child death initiative. So this year I'm going to present to you data from both their funded initiatives as well as county-wide data so that we can see what's really going on in the county, how these initiatives may be impacting those numbers. So as Linda had mentioned, and as you know, there have been a very large push to reduce the African-American child death rate by 10 to 20% after it was found that African-American children were dying at twice the rate of all other races. And also, as Linda mentioned, there are 4 specific categories of preventable child death that were of special focus. Each one had a specific percentage of decrease that they would like to see. And First 5 focused on these first 3: perinatal conditions, safe sleep issues, and child abuse and neglect, as those impact children 0 to 5. In addition, the Blue Ribbon Commission also identified 7 neighborhoods or areas in Sacramento that were the highest risk for African-American child death. Those include Arden Arcade, Fruit Ridge Stockton Boulevard, Meadowview, Valley High, North Sacramento, Del Paso Heights, North Highlands, and Oak Park. And you'll see throughout this presentation that many of the initiatives really focused their efforts on these specific neighborhoods. Just to give a quick overview of what I'll talk about for the funded programs, there are 4 main programs I'll talk to you about today that were funded by First 5 Sacramento. And they really range from being more macro, so kind of light touch, but impacting a lot of people, to more intensive working one-on-one. So the public education campaign was centered around the idea that racism is the root cause of the disparity between African Americans and all other races for child and maternal deaths. Safe Sleep Baby focuses on an education for parents to be able to safely sleep their children although open to everyone, with a special focus on African American families. Family resource centers provide a wide range of services for families, from light touch, sort of enhanced core, they call it. It's like stress relieving seminars, things that are more indirectly impactful, and then more intensive programming like home visitation and parenting education workshops. And those are really centered on focusing to reduce child abuse and neglect homicides. And then finally, the Pregnancy Peer Support Program works one-on-one, pairing mothers, African-American pregnant mothers, with a African-American pregnancy coach to take them through the pregnancy, really help them with every step of the way, and attend doctor's appointments with them and really be an advocate for that mother. So I will be going into more detail of the data or the results of each one of these funded initiatives. So the first one was the public education campaign that I mentioned, and this was managed by Runyon Saltzman. And the title of the campaign that began in February of 2020 was the Unequal Birth Campaign. And this was a new campaign that really had the goal of showing that racism is that root cause of racial disparities in safe births for both baby and mother. So it has nothing to do with education, income, cultural differences. And I'll steal a quote from Julie Galello here and just say that it's really racism that is causing these outcomes, not race. And so there was a large campaign that was multimodal. So there were radio ads that played on hit radio stations as well as Pandora. There were social media ads that were presented on Facebook and Instagram. There were also LED billboards that were around Sacramento County. And you can see in this graphic, that's an example of one of the billboards. And then also there was a micro website that was developed, unequalbirth.com, where people who had any sort of questions could be directed to. So questions about how they know that racism is the root cause, different research studies that have shown this, and just really for the entire general public to understand that this is the reason for those disparities. Safe Sleep Baby is the education campaign that is managed by the Child Abuse Prevention Council. In this education, parents receive a 1-hour workshop that teaches how to safely sleep your baby in multiple different realms. So you can see on the right, these are how participants sort of intentions versus their actual practices changed. So the number on the left is at intake, so before participating in the educational workshop. And then the number on the right of the graph is at follow-up, so after they have birthed their baby, what are they actually doing? And a few of these that I'd really like to point out are the Never Sleep Baby with Adult in Bed, which is the green line. At intake, only 36% agreed with that. And at follow-up, 75% were practicing that. So that's really, really impactful. However, there were statistically significant changes for all of these domains except sleeping the child in crib or pack and play, which even though it wasn't significant, I would like to point out that that was the highest percent at intake anyway. So it started off at 84%. So it didn't have much to grow, even though we did see an increase to 88%. In addition, almost 30% of the parents that they trained were African American, and over half of those parents resided in those high-risk neighborhoods that I mentioned at the beginning of this presentation. In addition, Safe Sleep Baby participates in a Cribs for Kids program. So as long as the parents attend the 1-hour workshop, they can receive a free crib if they need a place to safely sleep their baby. So with that program in the past fiscal year, almost 500 cribs were provided, and 36% of those went to African American parents. And finally, I just would like to point out that the Safe Sleep Baby initiative, it has been implemented in all of the main hospital systems in Sacramento. So all 4 main hospital systems and then all 8 birthing hospitals do implement this Safe Sleep Baby protocol. So there's been great partnership there as well. Next, I'd like to talk about Family Resource Centers, which is managed by Birth and Beyond. These are 9 family resource centers that are situated in some of the areas of highest risk for child death, child maltreatment, poverty, etc. And as I mentioned at the beginning of this presentation, they really do provide a wide array of services to families. Home visitation, parenting education, crisis intervention services, and then those lighter touch services called enhanced core. I'd like to show you the results from their home visitation and parenting education classes. So both of these use the adult adolescent parenting inventory to measure changes before and after the program. And overall, so you can see all of the different domains that the AAPI measures in the middle here. By all the different colors in the legend. But overall, as a general note, you can see that parents tended to increase on the AAPI from pre to post for both home visitation and parenting education. And a higher score on the AAPI is indicative of a lower risk level for child maltreatment. So basically the higher scores are parents who are less likely to commit child abuse. And I would like to just point out a couple scores on the home visitation. So the empathy one, which is like the pinkish color on the left, really increased quite a bit from 4.7 to 5.5 after participation in home visitation. And we also saw that same increase in parenting education. So from 4.8 to 5.7. And one potential area of focus moving forward for this group is the area of child power for those who participate in home visitation. So we actually saw a decrease here. It was very slight, however, and it was not statistically significant, but it is an area to focus on in the future.
Gordon, can you explain what child power is in 2 sentences?
Sure. So child power is recognizing the fact that children have autonomy to make their own decisions, to feel that they're having a voice in their family, rather than the more authoritarian parenting style of my way or the highway kind of.
Gotcha. Thank you.
And then the final initiative that First Five funded for RAACD is the Pregnancy Peer Support Program. And this was managed by Her Health First's Black Mothers United program. Overall, there were 180 pregnant African American women served in the fiscal year. And as I mentioned, this program pairs pregnant African American women with a African American pregnancy coach who can relate to the mothers on a cultural level, but also be an advocate for those mothers in medical settings, at birth, etc. 61% of the moms who participated in this program lived in one of those high-risk neighborhoods, which is really important, trying to target those mothers. And one of the things that's a big focus for this program is getting mothers to join this program early in their pregnancy so that they have the most time to have an impact on these mothers. So you can see that the majority of mothers in the past fiscal year joined in their second trimester. It can be difficult to get mothers in their first trimester just because mothers may be feeling overwhelmed with the fact that they're pregnant. They may not know where to turn, but this is a focus on the Black Mothers United program for the future. I'd like to show some changes in risk and protective factors that the BMU program has shown this past year. Protective factors, so we consider being on both WIC and CalWORKS a protective factor, as most of the mothers in this cohort do qualify for these services. So participating in the services is a benefit to them. So you can see that at intake before starting the program, 68% were on WIC, and at follow-up that had increased to 92%. So we can see that these pregnancy coaches are working with the mothers to help them realize the resources that are available in their area. We also saw an increase in the utilization of CalWORKS from 43% to 54%, and that was also statistically significant. Looking at some risk factors, just as in the last graph, the blue is at intake and the orange is at follow-up. So we are looking for decreases here. So you can see that across economic concerns or risk factors, we did see decreases in unstable housing, no transportation, and being unable to fulfill food needs, with that final one being statistically significant change. With regard to health factors, we saw very significant decreases in moderate to severe depression as measured by the PHQ-9. We also saw decreases in maternal report of nutritional deficiencies, although there were no changes in alcohol or drug use for mothers, which is an area of potential focus. But I do want to point out the decreases in tobacco use and mothers experiencing domestic violence as a positive of the program. So birth outcomes. So in total, 101 infants were born in fiscal year 1920. We have this separated out into twins and singletons just because twins are more likely to be born preterm and low birth weight. So in the far left column is everybody. The middle column is just twins, which is only 4 babies. And then singletons is on the right. So if we're talking about all infants, 80% of them had a healthy birth. If you're just looking at healthy birth weight, 88% of them had that. Full term, 83%. Unfortunately, all 4 twins were preterm and low birth weight. So then the singleton stats are significantly better because of the removal of those twins' poor outcomes. But overall, I would just like to point out the really positive outcomes in the all infants setting. We really have seen great results from this program. And then I'd also like to point out that there were 0 infant deaths that occurred in the perinatal period. So mothers continue to participate in Black Mothers United for at least a couple months after birth, some as much as 6 months after birth. And in that time, there were no infant deaths reported. So now I'd like to move to talk about the county-wide trends. So what is going on in Sacramento County that our programming may have contributed to? And before I start showing you the data, I would just like to let you know that we use 3-year rolling averages for these data in order to sort of smooth out any year-by-year anomalies that could happen. So we have agreed with Sierra Health Foundation to take that approach going forward. So you'll see 3-year rolling averages in their presentation as well. So first, if we just look at the rate of infant deaths, this is in Sacramento County. The blue line is African American infants. The pink line is the countywide average in Sacramento County. And then the orange line is non-African American infants. So you can see that from our baseline year of 2012 to 2014, African American infants died at a rate of 10.8 per 1,000 infants. In 2016 to 2018, that is now 8.8. That represents a 19% reduction overall and a 33% reduction in disparities between African Americans and all other races. Next, we'll talk about infant death due to perinatal causes. So these are things like being born extremely early, having very low birth weight, different infections that could occur during the birth. And you can see that this graph is a little bit less exciting than the infant death graph. However, from the 2014 to 2016 year for African Americans, where it seems to have peaked at 4.9, we're now seeing a decrease from 4.2 to then 4.1. We're hoping that this is the beginning of a downward trend. And I'd also just like to point out, as I mentioned, for the Pregnancy Peer Advocate Program, that program seems to be successful in reducing these types of infant deaths because there weren't any in their cohort from 1920. So I would just like to sort of put it in perspective that those births were only 101 infants. So perhaps the discussion of scaling up that program to be able to reach more families should be something that could be discussed.
Jordan, before you leave this slide,
yes,
is it appropriate to think that or to acknowledge that all the interventions associated with this effort started in earnest in 2013-15?
Yes, that's definitely a great point to make, that now that the programs have been completely up and running, we're starting to see these decreases. So that's a really great point and a very promising point.
Thank you.
Thank you. Sleep-related causes across the county have decreased at a very nice rate for African Americans. So in that 2012 to 2014 timeframe, they were dying at a rate of 3.7 per 1,000 by sleep-related causes. This has decreased by 51% overall, and there has been a 58% reduction in disparities between African Americans and all other races. And we can be sure that the Safe Sleep Baby Project has at least contributed to this, even though there are other programs aimed at this as well. We believe that the Safe Sleep Baby has had a really positive impact here. And finally, our most exciting graph saved for the end. So this is the rate of child deaths. So I'd like to point out that's different than the last graphs that you have seen have all been infant deaths. So this is child deaths ages 0 to 5 due to child abuse and neglect homicides. And that the implementation of the RAACD programs may be another reason for seeing the increase here, as Supervisor Cerna pointed out, that we actually saw from 2012 to 2014 to 2013, 2015, an increase. And then after that, a very, very stark decrease in the number of African-American child abuse and neglect homicides. So this actually has seen a 100% reduction overall. So for the past 3 years, 2016, 17, and 18, there were 0 African-American child deaths due to CAN homicides, and over a 100% reduction in disparities. So as you can see in the 2016 to 2018 portion of the graph, African-American children died of CAN homicides at a lower rate than non-African-American children. So this is really something to be celebrated, and something that the combined efforts of RAACD and Black Child Legacy Campaign can really be proud of. So with that, I thank you so much for your time, and I welcome any questions if you have any.
All right, thank you, Jordan. As always, very thorough. Appreciate that. So, any questions for Jordan? I see there's been a few comments that have been made in the chat box, but anyone want to ask Jordan anything about the data presented?
Commissioner Cerna, this is Commissioner Wirtz. Just a quick comment on the work of the Applied Survey Research Group and in partnership with not only the First 5 staff, but all the partners involved in this. I just want to, again, highlight the amount of work it is to collect this data over and above the work of doing the important intervention. So just an acknowledgement of the valuable work of all the partners in collecting data, reporting it, and giving it to our evaluators to allow them to work with this, to be able to demonstrate some of the valuable outcomes that have been successfully seen here with this. So kudos to everyone. Data collection is not an easy task, but I really, on behalf of the evaluation committee, want to commend you all for doing that and to keep our eyes focused on providing the data that helps us demonstrate the value of your work and the areas where we can improve. So thank you so much.
Thank you so much. And we really appreciate the feedback from Commissioner Wirtz as the evaluation chair, as well as the entire evaluation committee. This report gets stronger and stronger every year because of the feedback. So we really appreciate that. Thank you.
I'd like to second that as well. And to our partners for getting us the data for this evaluation. It's truly amazing. That last slide is so impressive. I mean, as a pediatrician, when we're talking about children and how they die, one of the things I tell my trainees is that society kills children through accidents and homicide and things like that. And while we use our stethoscopes often, that's not the most effective way to keep people from dying. So that last slide is just amazing, reflection of this work, and then how complicated this work can be and how it takes a societal approach. And so, for all of our partners that are doing the work, I really have so much admiration for you. And, to jump on Commissioner Wirtz's advice that we focus on the data, because we can't, prove these amazing things unless we have the buy-in of people giving us the data for you to analyze. Very important.
Great, thank you. Any others? I believe we're going to hear from Sierra Health Foundation, correct?
Yes.
Okay.
Thank you, Phil. Kendra, if you could please share your screen now, and Chet and Natalie are going to present.
And just so those that may be in the queue from the public that wish to address this matter, we'll get through the entirety of all the presentations first and give commissioners an opportunity to ask questions of presenters, and then we'll certainly get to public comment.
Kendra, you're going to share your slides and then we'll.
Yes, I am looking to share my slides, and it doesn't look like I can share my desktop, so I'm not quite sure how to do it.
I have you listed as panelists, so are you able to hit share screen?
Yeah, if I share my screen, it just doesn't come up as part of my option.
Let's see here.
You want to make her a co-host maybe for this, Linda?
Sure, that would be great. Thank you. Stephanie, can you do that on your end to change her to co-host? It doesn't give me the option. There we go. Thank you.
Welcome. Just did it. Kendra, do you now have the option to share your screen?
Yes, it just came up. Thank you.
Perfect.
Well, let me see. Once it starts coming up, I'll get started so that we can be as prompt as we possibly can. Let me just say that we too share and are delighted by all the good news. And in our presentation today, we're going to do really briefly a little bit of the background in history. We'll talk a little bit about how we know what works. We'll talk a little bit about where we are now currently. And then we'll talk really briefly about what we hope to have happen in the years ahead. I think I would be remiss if I didn't just want to acknowledge that in the midst of the pandemic, all that we are doing is made more complicated because of the limitations around engaging directly with people. And while we always celebrate data as an important marker for what we're doing, we know that our work is really predicated on relationships. It's about the ability to connect with folks who are facing challenges in their life, financial, poverty, social, economic, racism, and how that's driven, and our ability to help them navigate a path to a healthier future by the provision of services that helps empower families, support families, connect families, as well as to provide services to them as well. This really is an empowerment model. And as you know, I want to thank the commissioners for allowing us back here to report today, to share some of the exciting news. And while some slides are more exciting than others, we're excited about all the great work that's happening. Because downward trends for the mortality of children is something that you celebrate, and I can't think of an entity or an individual who wouldn't want to join in that celebration. And Supervisor Cerna, we got started with you on this effort some 6 years ago on another Blue Ribbon Commission. And we know that we had envisioned that we'd get to a point where we could establish the kind of success, and that is there. So I want to point out and make some particular thanks directly to you, sustained leadership on this effort. And I know you never want that to happen, and I always do it anyway, because where great leadership shows up, it should be acknowledged. And we all know when it's absent, we see the challenging things that can happen to people as well. So thank you, Supervisor Cerna, for that particular work. And I am stalling a little bit, we'll get the slides going, but I also want to call out our partners in this work. I see Bobby Davis and other folks who are on my screen. I just want to say thank you to the committee members. We like to refer to it as the Black Child Legacy Campaign. We think it's a more uplifting title, although the reduction of child death is what it's really all about. But to many partners, I can't see you all on my screen, but I just want to thank you for the many years of service that we've had going forward. And with that, the slides are up. I've done my intro. Natalie, who's my co-host, my phenomenal co-chair on this, will kind of lead us through the first part of the presentation. Can we move on to the next slide? And Natalie, I will turn the screen over to you.
Wonderful. Thank you so much, Chet. You know, I too want to just thank you all for this opportunity to stand before you to share the work of the Black Child Legacy Campaign. And, you know, I just first want to kind of lay the context for this work a little bit, and starting off with just sharing a reminder of this infrastructure that has been established over the years. You know, the infrastructure is foundational to the Black Child Legacy Campaign. And so it is important to have a backbone agency such as the Sierra Health Foundation, but it is absolutely critical to have an infrastructure in place in which to do this work. So while our work begins with the Steering Committee on Reduction of African American Child Deaths, and as Chet mentioned, we like to just refer to it as Black Child Legacy Campaign, because that's what it's about. It's a legacy for our children, for our families. And this work, this initial work with the Steering Committee is what is funded through the First 5 funds. And we've been able to leverage this work of the Steering Committee to build out this infrastructure that you see on this particular slide. And so beyond the Steering Committee, we do have community incubator leads, which we refer to as CILs, and you'll hear from some of them, the leaders today. Jordan mentioned the 7 neighborhoods that were targeted neighborhoods with the highest incidence of disparities in child deaths. And so these community incubator leads really are focused right there in the neighborhoods. It is a community hub, if you will, that is made up of a team of extraordinary individuals, leaders in their communities who serve to do this work. You can see on the screen the 7 targeted neighborhoods that are identified, and then also you'll see the agencies that serve as the lead agencies for each of the CILs in these particular neighborhoods. Not only do we have that community incubator lead, but we have a team that is built within that structure. We call it a multidisciplinary team that is made up of a multitude of agencies that provide comprehensive and cohesive, holistic support and services to the families right there in the community. And again, you'll hear from them later today. We also have been able to leverage some funding for Healing the Hood. That is also an area that is focused in on that violence prevention. So we want to thank you again for setting us along this path of the Steering Committee from which we are able to build out this strong infrastructure of support. So within this work, I just want to share with you the big picture. And this is just kind of the highlights of some of the things that we've been able to do over the past 5 years. And it's been nothing short of amazing. And really, this is really kind of reporting the work of over 3 years, just when you time things out. And we are just excited to report that, you know, we have seen that reduction in the deaths of African-American children by 30%, in infant deaths by 19%, based on when this data was collected, and that there has been a 58% reduction in that disparity of infant sleep-related deaths. And I think one of the pieces that we have been most proud of is that over the couple of years of 2018 and 2019, we've not seen any juvenile homicides for Sacramento. And that is huge if you consider what the headlines were before us as we began this work. And then we've also been able to put a cultural brokers program in place where they're able to make referrals to agencies to really support families. And then in 2019, back in the spring, we were able to be recognized as a community from the National Association of Counties Health Steering Committee based on the work that we've been able to accomplish as the Black Child Legacy Campaign. So on the next slide, you'll see just a snapshot of how we got here. And, you know, I would be remiss if I didn't as well just say thank you, Chair Serna, for your leadership in this work that has continued to keep this first and forefront in our communities. It is so critical that we have strong leadership that continues to stay the course on what is right, what is important, what is equitable, and what is just. So we thank you for your leadership. This work, really, I would say we were able to kick it off in 2015. So I just want to go to the middle of this chart because this is the time frame in which the steering committee was created. And this is the work that really begun. And it begun with a couple of things. One, with that very clear vision in terms of what we needed to do with the implementation plans, the strategic plans that were created. But also it was important that we set up that infrastructure for which we'll do this work. But the other part of it is actually naming this work, calling it out for what it is, and unapologetically identifying it as that legacy that we feel is so important for Black children. And we set that goal of making sure that these services were very targeted and very explicit to the population, but also it would be universal. And so we launched the name Black Child Legacy Campaign to encompass the work that is being described today. And so we continue to do this work. In 2016, you can see just within a year, we were already able to surpass our goal of that 10% reduction that was set out right from the beginning through the Blue Ribbon Commission. And then also 3 years later, we've been able to make some significant improvements in the outcomes for our young children and youth. So I'd like to just pass this back to my co-chair so he will unpack the data for you.
And I can be brief here because I think Jordan did a great job early on, and I think we've celebrated the tremendous achievements that have been made. On the left-hand side of your slide, you see all-cause child mortality rates, and you can see that goal was reduced by 10 to 20%, and in 2018, we have actually made a reduction of about 30%. On the right-hand side of your slide, you see the 3-year rolling averages in relationship to data that Jordan presented earlier as well. And you can see the reduction in perinatal conditions, infant sleep-related death, child abuse and neglect, or what we call CAN homicides, and of course, the third-party homicides on that slide as well. Really impressed by the data. And as you all know, that child deaths have been decreasing over time for some period of time now. It was both the slower rate for Black children and the consistency of the disparity of children and other populations that had remained consistent. And what this data actually shows is that we are really addressing both of those challenges at the same time. And I think as Dr. Fernandez-Garcia pointed out, the notion of doing this and really impacting the disparity is a phenomenal achievement. What it translates into is the kids who are alive today that absent these interventions are likely not to have been. And I think that we should never lose fact about that, even as we look at numbers, we're really talking about children. Next slide, please. This slide simply lays out the third-party homicide. We saw a slight increase. I know that is not the focus of First Five's investments, but we know you're also concerned about violence as relates to the lives of children. And you can see how small changes in 2017, and we got back to 1 in 2018, but as you smooth that out over a 3-year period, the data looks like it looked at on the previous slide. We continue to be very focused on this particular issue. We have built in some additional supports into the Black Child Legacy work known as Healing the Hood, bringing in some additional state resources to focus on this issue of violence. And I would just say, because we've all seen the news as of recently, where some tragic incidents have actually taken place, that part of the impact of the pandemic as relates to issues around depression, anxiety, and stress that can often show up as shorter tempers and less tolerance on the behavior of folks who may more quickly move to violence. We're really concerned about this particular issue and what we're likely to see in the years ahead. So just a flag for that particular issue, and want to hold that out. How do we know it works? This is a chart. I'm not going to go through all of it. You have the presentation. Talks a lot about some of the things that often don't get caught up in the very specific focus data that we saw earlier. 70 community partners participating, 18 community leadership councils. Of course, resources, 10.9, it's actually 12.7 million to date. Trainings, as we're really strengthening the ability of our community partners to be effective interventionists, right? To go into families, to understand how to be of sort, how to craft and deepen relationships so that folks are more likely to take up the supports and services that are available to them. I remember 4 years ago when I presented this commission, we talked a lot about drug courts, and we said there was lots of avenues out there for people to participate in, but people would not simply come. So building a sense of connection and people's sense of safety, that these programs are not designed to penalize you for some shortcoming you may have in relation to your children or your inability to get to your healthcare appointment, that they're to help you make better choices so that your children can be healthier, has really taken root and something that we should all be very proud of. Of course, we have a lot of youth engaged, over 2,500 young people, and some really powerful system change wins since 2016. The hospital adoption of safe sleep protocols for all births was talked about earlier. Have to call out Dr. Ethan Cutts and Diane Galati, who's no longer on the commission, for stellar work in getting all 4 health systems to adopt the safe sleeping protocols and trainings for parents. And we started doing this for Black children because that was the focus. But great policy for children is great policy for all children. And now I believe something like over 85% of all children born actually get access to that particular service. Of course, with our county partners who have done stellar work, the outstationing and multidisciplinary teams in communities, centers, and trusted institutions has been great. Our county child protective services in place with the cultural broker program. You've seen the fantastic numbers and declines of child abuse and neglect homicides, which are more likely to be committed by people who are known to that family. Right? So that is a tremendous achievement on their part. And then, of course, of the adoption of the countywide hospital crisis response protocols. When there is a violent act that results in a hospitalization, we have folks who can go out and actually support families of victims, as well as the perpetrators, to ensure that violence does not continue. With that, Natalie, I'm gonna turn it back to you.
Absolutely. And so on this next slide, these numbers before you really help to tell the story of our work. And I'm not going to read all of the numbers before you, but you can see some significant activity that has occurred on behalf of the Black Child Legacy Campaign, work that's focused on case management, making sure that pregnant women are receiving BCLC services and that we are reaching out to families to make sure that they are sleeping their families safely and then referring them to services and supports that they may need. You can see the number of youth that are engaged in this work. And then they have some opportunities to learn and be a part of the solution right here in their communities. And then on the next slide, our community members have been involved in leadership activities. And you see that right at the top of your screen. And then families do come to their community incubator lead, their communities with a number of requests for support. And one of those requests has to do with housing related services. And so we are providing services to make sure that our families are healthy and strong and safe. And that includes connecting them to the housing services that they may need. Also making sure that we're connected to some of those multidisciplinary supports through probation, through CPS, and you can see that. And then also just the work with our community intervention to make sure that our young people are safe and they are making healthy and wise choices for a quality of life. And so you can see the data before you regarding the families, the youth that we are serving. So when we began this work, the narrative was quite different. And I am excited that we have changed that narrative. there would hardly be a day that you would open the newspaper or watch TV or look online and you were just met with devastating news. And even though we're in that phase right now, that Chet just mentioned, there are various reasons for that. But I would absolutely say that the work that we've been able to do over this journey has changed the trajectory of the lives of our children, our young children, our youth, our families. And it is because of this work. And so the narrative has looked quite a bit different since BCLC really entered into this particular community. And a large part of that success absolutely is attributed to the fact that this is a community-driven movement. It is really the work of community members, leadership of the community members, people who see Sacramento as their beloved community, wanting to make sure that they are the ones who are making a difference. And so I think our community incubator leads, I thank our community partners who have been a part of this work, because that is what has contributed to the success of this work, as well as the youth engagement approach that has taken place throughout all of this work. So next slide, please. So as Chet alluded, there really has been some great challenges during this time, during this COVID-19 season. And there have been some increases in the violence and in the health concerns that really plague our community. And we know there's a lot of root causes to the violence that we are beginning to see. And you can see that indicated on this screen. The poverty, the intergenerational trauma, the institutional neglect, the list goes on. And so we know our families are hurting right now. And I'm very thankful that we do at least have an infrastructure in place that is continuing to provide some support within this pandemic. And so you'll see on the next slide that we have had a response to our beloved community right here in Sacramento. And this slide does provide you with a snapshot of some of the work and the support that our community incubator leads have been engaged in to really help to offset some of the trauma, some of the hurt, some of the health concerns right here in our community. This is data from March through June of this year, and you can see the number of individuals that have been served by the community incubator leads specific to COVID-19, nearly 30,000. We've been able to provide food boxes and making sure that our families do have some meals to sustain them during this difficult season. We have made sure that we have supported, almost 2,000 families during this time. You can see that breakdown of the individuals that we are providing services and supports to on a regular basis. And, our community incubator leads are really stepping up in a major way. And I do want to just acknowledge the South Sacramento Christian Center that serves as our community incubator lead out in the Valley High area with Les and Katrina Simmons as the leads. And they have done some phenomenal work. And in fact, they are serving as the major hub for food distribution here in our community. And so thank you to them, that whole team, and to all of our community incubator leads. Our families feel like they have someone whom they can go to, trusted individuals in their community that has their back and that is going to support them through this pandemic. So thank you to the team. And so Chet, if you will take us through the 5-year results as we round out this presentation.
Here are the 5-year results, and I'll do this quickly. We really built on an initial investment of $7.5 million, which was enhanced with a 1-year extension. So thanks to the Board of Supervisors for their ongoing support. The good data, as Commissioner Word said, was really helpful in giving people the confidence to make that level of investment without us doing a presentation because of the pandemic and our inability to actually get that, calendar. We built a lot of capacity at the center to actually do this work. And in some ways, you can almost describe us as being prophetic. Who would have known that 2020 would look like it did? Where would we be if we had not built a community infrastructure to be able to reach children? Think about the fact that while we are really focused on getting things to be even better than they are now. If not for that infrastructure, it's likely they would be far worse. So sometimes in doing the right thing at the right time, you're really setting yourself up to do some tremendous work, in the future. And I want to thank this commission for having the foresight to help launch this particular effort. Otherwise, we might be in our 25th consecutive year of having poor outcome data for Black and brown and poor children in county, and far too little of an infrastructure to actually make a difference during the unanticipated pandemic that we're currently facing. We have been aggressive on progress on all our particular work, great infrastructure, good quality and evidence-based programming, national recognition of celebration, and this narrative and change leadership, which has stood up new leaders in communities who, heretofore may not have seen themselves as such, but who now know that they have direct connections and relationships with public institutions to help them advance, their particular work. And when you talk about diversity, equity, and inclusion, this is what it looks like in action. This has not been filed by title. This has been followed by truth and our behavior. Our big ask is, given where we are, we know we're going to have some fallback because things are just that much more challenging. And we're looking ahead to the next at least 3 years so that the progress that we might lose, and I don't like calling negative things to the word, but that we might lose given the enormity of the challenges that we're actually facing, are not allowed to reset the dial for us, going forward. Otherwise, it makes all of our work and all the money lost leader dollars, and that's not what we're about in terms of our change effort. Last slide, please, and then I can close out. And I apologize for taking more time than we were allotted, but we really wanted to get through this presentation. Here you see is, some of the acknowledgments for our work. I just want to make a very few points. We started this work without a good roadmap, and people said to us, what was going to be the best practice? Where would you actually find them? And given the work that we've achieved, we know now there really was no roadmap for doing this work. This has been path-setting work. The publications and research you see are a testament to that. But I didn't ask them to put on a slide to celebrate our notoriety. That's not the point of this. This is to celebrate our leadership. This is to celebrate what happens when you follow that collective impact strategy. This is what happens when you're not tied to best or emerging practice, but you're building upon that so that you can actually advance practice at the same time. The Black Child Legacy Campaign, with the support and leadership of First Five, and the support and leadership of county departments and county leadership, is being replicated in at least 3 cities in California. And we have inquiries from across the country about how we were able to actually organize this work. I have personally had the privilege of speaking at many of these panels. I know Supervisor Cerna has, I know Kendra Montgomery, who's our shining superstar behind all this work, and there cannot be a presentation on this without calling her and her team out at the foundation as well. But we are redefining what best practice in this arena looks like. And you see this gray on my chin. I've been at this a long time, but I can tell you, this is some of the most phenomenal work that I've ever been part of. And we should all be extremely and collectively proud of what we've been able to achieve. The world or the nation has been watching when we talked about the launch of this campaign, and I can tell you they are impressed. And with that, I will turn it back over to you, Commissioner Cerna.
Great, thank you, Chet and Dr. Woods. I really do appreciate all the tremendous leadership from both of you. You've been kind enough to express your gratitude towards a number of others, including myself, about leaders, but quite frankly, without the very deliberate and thoughtful approaches that have come from you, Chet, and Kendra and Dr. Woods, I'm not sure that we'd be here celebrating what we are. And as I mentioned time and time again, continue to say so when I have the opportunity about Black Child Legacy Campaign, is that this was from day one always intended to be certainly about our community, to be honest with ourselves about the challenge of attempting to tackle something as complex as disparities in mortality rates for African American childhood population. But it had to necessarily be owned by the community and absolutely has to be changed by the community. And it can't be associated with a single person, a single politician, a single agency, a single nonprofit. And I think what we can certainly all understand with the slides you presented is that that's exactly what has happened. And the success that we can all celebrate and enjoy and hopefully share with other communities across the country is really steeped in that partnership. And without it, again, I don't think we'd be having this discussion. So I just want to extend my gratitude to everyone who has touched this program from day one, who continues to stay involved. As Chet mentioned, this unforeseen pandemic is something that's going to have consequence for local government for a long time. I'll just be honest with you, it's going to be years in terms of the impact to us fiscally, to the health of our community. And so I'm not necessarily here to tell you to get ready to play a lot of strong defense, but there's not much, quite frankly, that we can celebrate in local government these days, which is as positive as this. And so, shame on us if we can't all be vocal at the right time to remind ourselves, remind the community, remind our colleagues, those that are making decisions, that this, if nothing else, is one of the best investments that we make of our time, energy, and treasure. And it's measured in lives saved. And so I challenge anyone to tell me there's not a more important metric to gauge in terms of a successful intervention or a series of programs. It really does represent local government at its best in partnership with all the other partners that have been mentioned. So with that, like I mentioned earlier, I want to give commissioners first an opportunity to ask any questions or offer comments for Chet and Natalie and Indra. And and then once we get through that, we'll go to the members of the public that would like to address the commission on this matter.
And I'm sorry to interrupt, Supervisor Cerna. Sierra Health Foundation, related to COVID and the collective impact model, they actually had a video they'd like me to share. Is that okay?
Oh, that's fine.
Okay.
I was unaware of that.
Sorry about that. I'm going to share my screen and you can see.
Well, that'll give all the commissioners time to formulate their questions and comments.
It's just under a 2-minute video.
Great.
Thank you. Okay, now I'm going to turn it back over to you all.
Great. Okay, so any questions or comments for our partners with Sierra Health Foundation? Yes, Commissioner Fernandez y Garcia.
Yeah, I'll have to step away in a few minutes. So I wanted to make sure to just, reiterate and thank you all again for the amazing work that you're doing. I mean, it's astounding. And I think it just shows what we've all known, that if we invest, if we give money to neighborhoods and communities and the work we're doing, we're going to have positive outcomes. And it's just a tremendous illustration of that. I think it is daunting to think about the challenges that COVID is gonna present to us in the future, but the groundwork that has been laid, the foundation of community and neighborhood partnership and interaction, creating a system, not a safety net, but a true system of wellness. It positions us to weather this storm that's coming from COVID, a way that I can't imagine if we didn't have this system in place, how bad the effects of COVID would be. We don't know how bad they're going to be. They're going to be terrible, but it would be a million times worse. So I just, wanted to take this opportunity to thank you all for the work that you're doing. I grew up in Meadowview, and if we would have had this back then, I just imagine how amazing all the friends that I've had that have fallen by the wayside and have had, a much harder life. Where would they be right now if we would have had this? So again, thank you very much. I apologize that I have to step away, but I just had to say my piece. Thank you again.
Great, thank you.
This is Dave Gordon, Chair Cerna, if I may, because
yes,
I have to leave a bit early. I just wanted to say a big thank you and just say how impressed and proud I am of the work that's been done, because it was much more than changing the way we did things. It was really investing in the leadership and the people in the community and cutting them in on what needed to be done to turn this whole situation around, and bringing forth potential leaders, the youth engagement, bringing youth voice into it. So I think all of you have done so much more for us than just work on solving a problem. I think you've energized the community, and you've built the capacity to grow leaders. And I've seen them over and over stepping up year by year as this has gone on. So for a three-year renewal, boy, I'll lead that parade in a heartbeat. So thank you all, and Kendra, your leadership has been extraordinary, and your team on the ground. So thank you. It's extraordinary work, and I look forward to seeing it not just continue, but to grow as the years go on.
Thank you, Commissioner Gordon.
Bill, I can't find my button down there in participants today to raise my hand, but I just want to add in that I just shudder to think where we would be if this had not begun so far back in 2009. I remember driving to all those areas to build trust, not because of me, but taking Grantland. And that a few people would come out, a grandmother would come out, or maybe, an uncle. But to think of the distance that has been traveled, and that this infrastructure, this absolutely efficient, if you will, infrastructure is there, and to what might have been happening today, if not, is just beyond our imagination. So it just shows what a community can do when it comes together. So there are so many kudos to be given, but certainly to the team with Kendra, who I've known for some time, of course, Chet, and Natalie, and all the others on the ground in the incubator leagues that are doing this. And of course, to Phil and those people that are the leaders in our own commission. There's just not enough words can be said. I just feel very emotional about it. And I worry about the babies out there right now when there hasn't been enough stimulus again, and families are out of work, and there isn't enough food, and we're doing clearly tremendous amounts, but I know there's more that's needed, and I cannot help but think about those things daily. So thank you all for every bit. Just imagine if this screen with all these wonderful people that have done so much wasn't here. I just can't even, it makes me shudder to even consider it. So thank you.
Thank you, Commissioner.
Mr. Chair, if I may.
Yeah, Bruce.
Thank you. You know, this is one of a few updates that I've seen on this, and every year it's inspiring to see the results of this. And as I listen to Chet and Everett today, not only am I so pleased with these results, but I think about ways we can apply this model elsewhere. We have disparities in a lot of our program, as you know, Mr. Chair, be it child welfare, be it receipt of public assistance, and I could go right down the line. And these have been very difficult barriers to deal with in that regard. So I think this model of community partnership and leadership, I find myself thinking about how we can apply it elsewhere as well. Not only continue this effort, which I think we absolutely need to do, but look for ways we can use this model to address other areas as well.
Well, I will tell you that a large part of the inspiration for the Commission on Women's and Girls Issues kind of came from the experience of the Blue Ribbon Commission that we established back in 2011, and you know, the issue of gender equity is something that I think we can begin to tackle in a similar methodical way, assuming you know, the rest of the board feels likewise tomorrow. I hope they do. But I think you're right. I think this is not only, as Chet mentioned, kind of setting the mark, setting the bar, if you will, as a best practice for others to note. But I think it can be a model for us internally to Sacramento County in terms of so many other disparity issues and equity issues that need addressing.
Right.
No doubt about it. Any others before we go to the public who's been waiting patiently? Okay, Carmen?
Yes, we have 7 people signed up to speak, and then we have 2 new callers. So we will take the speakers that have signed up to speak first, and then we will go to the phone lines. So first on is Ms. Shaw.
Thank you. Well, good afternoon. First and foremost, I would like to thank the First Five Sacramento and the Commission for your ongoing support and investment on the reduction of African-American child deaths. Although we know that racism drives racial disparities in infant and maternal health, it does bear mentioning that underinvestment in programs to address the root causes also contributes to this alarming trend. But that's not the case with this group. And on behalf of Her Health First and the Black Mothers United program, we are deeply grateful for the bold leadership demonstrated by both First Five staff and the Commission, and the ongoing investment that you continue to make in African-American infant and maternal health. So thank you. 2020 has been a difficult year for everyone, and we've all been forced outside of our comfort zones in different ways and for different reasons. Despite these challenges, Her Health First and our BMU staff have continued to provide support, access to resources, and a place that feels like home to our pregnant moms. In March, our pregnancy coaches quickly adapted and without hesitation to public health recommendations because they understood the impact of not having our services as a critical resource for our pregnant and parenting families. Even in the middle of a pandemic, because we are committed to our moms, we made all of the changes necessary to keep everyone safe while still supporting them in their pregnancies. We continue to celebrate the joy of pregnancy and simultaneously hold space for the traumas our mothers experience, most simply because they are African American. 2020 has brought with it global suffering that has forced the world to rethink the way that we live. And our agency took this as an opportunity to adapt, as women of color have always done, and found a way to keep our pregnant moms safe while continuing to shift narratives about Black mothers and families. Our adaptations have been successful because it has been a collective effort. We communicate, listen deeply, and engage all staff, clients, and families into our conversations. And also to the note about the amazing work that's happening with the CARES Act dollars in partnership with Sacramento BHC Hub, Kim Williams, and the Fruit Ridge Stockton CIL, Her Health First in partnership with that has successfully distributed over $286,000 in supports to pregnant parenting families and just families and individuals in general throughout the county since October. So we are definitely proud and appreciate the support of all of our partners, many who are on this call. And again, just my thanks to First Five and to the commissioners. Thank you.
Great. Thank you, Shannon, and thanks for all the great work that you continue to do for the community.
Next up is Miss Stephanie Biegler.
Good afternoon, and I certainly want to echo all of the thanks to the Commission for the boldness in this initiative and the generosity in the continued funding. Particularly for the Safe Sleep Baby program. We happen to think it's a pretty effective program. For $200,000 a year, we collectively are saving the lives of infants from a sleep-related death, anywhere from 8 to 12 infants a year. The reason why we're able to do that is that the model is grounded in the public health spectrum of prevention, which means that our education is reinforced by any provider that a pregnant or new mom comes in contact with. That includes hospitals, that includes county public and private agencies such as CPS and WIC. It includes home visitors and birth and beyond programs. The Safe Sleep Baby campaign is developed by parents for parents. All of our parents in the brochures and in the individuals and in the videos are Sacramento County residents, and we really think that is responsible for the effectiveness in the program and the relatability of the message. At the heart of Safe Sleep Baby, though, is the incredible work of Gia Lewis and her team of Safe Sleep Baby specialists. They build trust with parents almost immediately. They are a cultural, linguistic, and demographic match with parents. And our parents have told us that they feel very empowered, and they are reassured that they can be a good parent by implementing Safe Sleep Baby practices. COVID, as everyone else, has presented a challenge. However, thanks to Zoom, we are able to still provide 1 hour of education before we go and drop off a crib. We have our version of Crib Dash based off of DoorDash, and it has worked quite successfully, we're happy to say. You know, one of the things too that we wanted to share with you is that Safe Sleep Baby is breaking generation and cultural misconceptions about safe sleep practices. And I want to demonstrate that by this really short story. Diane, one of our stellar Safe Sleep Baby specialists, had done a 1 hour education with a mom that was due in 2 days, brand new mom. And she drove to the mom's house after the education, dropped off the crib, and as she was walking down the driveway, the mother's mother, which would be the grandmother, said, "Excuse me, can you please provide me the 1 hour education as well? I want to make certain that I'm the best grandmother I can be." And it just so happened that that mom had co-slept with her daughter, and the daughter was going to co-sleep with her infant prior to our education. Finally, we also want to share that Sacramento County Safe Sleep Baby program has received national recognition. We are the Child Abuse Prevention Council, part of a 5-state demonstration project to reduce child abuse and neglect fatalities. And through that work, there was a lot of interest from our Safe Sleep Baby results. So we are going to be talking to Cook County, Illinois, the state of New Jersey, and the state of Arkansas. And we also have received recognition as an innovative design implementation program, and certainly recognition for our outcomes with the Casey family programs. So once again, heartfelt thanks to all of you, and it's a pleasure for us to share in this countywide success with everyone.
Great, thank you, Stephanie.
Next up is Miss Danielle Lawrence.
Good morning, everyone. Thank you, or good afternoon, I should say, Chair Cerner, commissioners, and staff. It's a pleasure to come before you on the heels of such a wonderful presentation. I'm just like thoroughly heartwarmed in this COVID season. It's not a lot to celebrate, but this work I absolutely do celebrate. My name is Danielle Lawrence, and I am the Executive Director of Mutual Assistance Network, otherwise known as MAN. MAN is privileged to act as both a Black Child Legacy Community Incubator and 2 Birth and Beyond Family Resource Center sites. We have an amazing staff and serve the most resilient residents in the neighborhoods of Del Paso Heights and Arden Arcade. Arden Arcade is the home of our incubator with Black Child Legacy. So I'm going to highlight a few points, and then I'm going to just thank you for the great contributions. In 2013, MAN took on the work as a result of the Commission's commitment to specifically address and pick up the charge to decrease the disparity of African-American infant and child death in Arden Arcade, and we became a Birth and Beyond site. It's important to note that that Birth and Beyond site was reestablished after Arden Arcade had no services for quite a few years. Our foundational work at the Arcade Community Center then enabled us to focus on and ultimately led us to continue the charge and become a Black Child Legacy site in 2015. And again, a Black Infant Health site in 2019. So there's a theme, right? And so the charge that you all gave back in 2013 has carried itself on in the spirit of MAN. Rooted in cultural responsiveness and equity work, MAN has been able to build efforts in the following ways. 1, we reestablished services in Arden Arcade, building and leading a strong web of supports with partners. We have successfully been able to bridge the systems with intentional community work. And those of you that have bridged systems, it's a big feat to do. And we have been able to do that very well in Arden Arcade, and it's something we're very proud of. Additionally, we were able to create and lead a community impact group made up of key stakeholders and residents. This group has evolved over the years and is rooted in transparency. It enables us to be advised by, build capacity in, and even pass a baton to the neighborhood to lead various community events and advocacy work. Additionally, we have been able to lead in and focus on our internal collaborative efforts as both a Birth and Beyond and a Black Child Legacy efforts on cultural responsiveness and African American engagement. We also developed the creation of an advocacy cohort where community leaders went through an opportunity to learn about civic engagement and advocacy work and build capacity as community leaders. Lastly, one thing to lift up specifically as it pertains to child abuse and neglect is that we've been able to provide one-on-one case management services specific to families directly in contact with CPS. And we see that intentional effort wrapped around creating a wraparound approach to educate and then support families that have had their children removed already and or at the brink of having their children removed has been something that has been phenomenal. So what we recognize is that the work through the partnerships and through our staff that are definitely committed to this work in our neighborhoods. We have a proven health equity and racial justice strategy that is with trusted and trained community networks. It is imperative that the strategy continues to be supported and funded. It is our pleasure to do this work, and as Kendra has embedded in us, give our deepest yes to this work. I want to personally thank each and every one of you for your commitment and dedication to this cause. And as you can see in the results, your investment has been well spent in the saved lives of the children and their families that we serve. So thank you, much appreciation.
Thank you, Danielle. Thank you for all your great work as well.
Next, we have Kenya Fagbini.
Hi, good afternoon. I'm the program director at Her Health First, and just wanted to say thank you to commissioners and to First Five for all of your support and giving us the resource to be able to do this most important work. Her Health First has recently gone through a trauma-informed training. It's called Uncovering Racial Trauma by Dr. Kenneth Hardy. And a couple of things that really stuck out for me in this training really correlated with the work that we're doing through our Black Mothers United program, as well as all of the programs that that were presented today. And one of the things, or a term that Dr. Kenneth Hardy used, was psychological homelessness. And what that meant was the absence of a safe place for families to be able to talk and discuss and express issues within the Black community. And one of the points that really dug in deep for me was about toxic stress. And one example of the toxic stress that I think that a lot of pregnant women carry is devaluation of their pregnancy. We know that Black women during their pregnancy and thereafter, if they have children, it's not always looked at as a positive thing. And so Her Health First and our Black Mothers United program is intentional in uplifting our moms during and after the pregnancy, helping them understand that it's okay and it's important that they, like anyone else, build their family and have a plan. And one of the things that we have done is provided a home for these families, for them to be able to share and receive positive messaging and education, as well as resources so that they can navigate through some of these stressors that we know contribute to infant mortality and across the board morbidity. And so the training is something that we have incorporated into our agency. All of our staff took it, including Shannon Shaw, our executive director. And we just, again, found very similar correlations in his training that was looking at how we address these invisible wounds that Black families walk around with and carry on a daily base. And again, not having a safe space to talk about and express and share their learned experiences and how to, especially during this pandemic, be able to address some of the stigma and stereotypes about mental health and all the things that, again, we are challenged with. So I just wanted to share that today and just place on everyone's mind that when we're thinking about pregnant moms, we have to stay in the business of celebrating them during and after their pregnancy, because it's important for moms to really feel that, how we shape our own thoughts about how we feel about ourselves is quite often a reflection of our family, our friends, our partners, society as a whole. And so to that, I just want to make sure that we keep that as a forefront as well when we're thinking about Black women and their pregnancies. But thank you for allowing me to speak today, and happy holidays to everyone.
Thank you, Kenya.
Thank you. Next up is, I believe, I'm sorry if I'm mispronouncing your name, Jadida Gomes.
Hi, my name is Jadida Gomes. I'm speaking on behalf of the Greater Sacramento Urban League. No worries, most people get it wrong. We have the honor of leading the Oak Park CIL. And as you've heard, the work BCLC is doing throughout the city is indispensable. The BCLC has become a pillar of trust and stability in our community, and we continue working tirelessly to close that gap. Without this connection and presence, many families would go without advocacy, accessing resources and services that are needed. And if I'm honest, sometimes is a right that has been often denied. And so with these disruptions and barriers that plague our community, the work that we do is so valuable and needs to be long-term. With the pandemic, we have doubled down on the work that we have been doing and have added services as, again, it has disproportionately impacted our community. It's been our honor to be able to serve through food distribution, one-on-one mental health services, mentorship, rental assistance, to name a few. The need for these resources are even more pressing and still continue. And so we ask for your long-term funding and commitment as we commit to serve our community. Our families need the assistance to overcome these barriers. And we realize that our work is arduous, but it's so critical. So we just want to encourage you and challenge you to continue to support us as we press on to serve, for us specifically, Oak Park, but the whole city. Thank you for your time.
Thank you.
Next, we have Yolanda Stevenson.
Good afternoon. I would first like to thank the Board of Supervisors, First Five, and the Sierra Health for giving us a platform to share some of our successes. I would like to first start by saying that we are still working deep in our communities because we love our community and want nothing more than the safety and health of our families, young people, friends, and our neighbors. We also must have long-term funding and support because we can't talk about Black health and equity and reimagining public safety without talking about all of the overlapping concerns that our communities face, including economics, housing, environment, education, unbiasedness, and accessible healthcare. But even with those limitations that COVID-19 has placed upon our community agencies and the world alike, we are still here at Meadowview Black Child Legacy Community Incubator and Rose Family Creative Empowerment Center, still committed to finding innovative and creative ways to serve our families with the highest level of support services through this trying time by way of offering learning labs at our facility and working with the Sacramento School District to model our success, like John Steele K-8 and Susan B. Anthony that are now modeling that skills support our struggling children that's going through like Google Classroom and internet access. We're still providing our families with supports with the PPE supplies, home visits, mental health services, rental assistance, and motel vouchers, and also addressing the families with their basic needs and concerns and referring our community partners and continuously doing our food boxes, serving about 250 families monthly with food boxes and their hot meals. And the greatest thing of all is through this pandemic and also working closely with all of the 7 Black Child Legacy campaigns, we have created a stronger collaboration with our partner agencies that have shown great success in serving and building healthier relationships with our families and community, and also abroad with the different agencies that we are working in synergy for the same goal, with the same passion and the same heart and drive. And I'm just grateful for being a part of this project and looking at it continuing even more so we can serve even more families moving forward.
Great, thank you.
Next, we have Kim Williams.
Good afternoon. Thank you. There's been so much already said about how amazing this program has been, and I don't want to prolong that. I just want to say thank you so much for the support of this commission. We couldn't do this work without your support. The needs of the Black Child Legacy campaign, they've already been proven in the data and the results that we've seen. But I can say without a shadow of a doubt that every single CIL that is represented here on this phone, our county partners, have seen the increase with the pandemic, and that just shows how much more important this work really is. We know African Americans have been impacted disproportionately even before the pandemic, and we know even after the work is even going to be greater. And so we need your continued support to continue doing the work and making the strides in our families that we want to continue to see. So we continue to appreciate the uplift that you all do to help make that happen for us. I think the other thing I just wanted to share, having done a lot of work in community and have been in the nonprofit venue all of my working career, what is so unique about Black Child Legacy is this partnership that you have between county, with CBOs, community, law enforcement, everyone working together with a common goal and a common action. We see the results and we see what happens when we all come together to really come together to make a difference in an issue that we have seen our families be hurt by. And so, but we now have seen what can happen when we all work together on it. And that's a testament to everybody on this Zoom, but also it's an opportunity to show people around this country that we can't work in silos, we can't work in vacuums. There's no way we're going to solve the issues that are deep rooted in a lot of our vulnerable communities by working individually, that we've got to come together and do this work. And Black Child Legacy is a great example of that. So I thank you for your support. I thank you for your continued support. And we look forward to continue serving our families and giving them every opportunity they can to succeed. Thank you.
Great. Thank you, Kim.
Julius Advanced Peace Organization.
Good afternoon, everyone, to the honorable members of the county here. This is my first time even being before you. I am the strategy program manager for the Advanced Peace Organization of Sacramento. I just want to talk real quickly about our efforts as being a part of the Healing the Hood collaborative. As the sister Kenya had spoke, how the population that we serve deals with so much toxic stress, which leads to them being stunted in their brain development, or most of the children that have adverse childhood experiences and who have been impacted by both direct and vicarious trauma. We try to reach out to them as we know the dysfunction and not having access to programs where they receive cognitive behavioral therapy, and it pretty much are not being serviced in a manner because they're the most difficult population to serve. I could have summed this up real quickly in saying that you can't reduce gun violence when you're unable to reach or unable or unwilling to service those who carry and use guns. I think my partnership with BCLC, and one of the things that Kendra and I have clearly stressed, is our commitment to a holistic approach towards healing, which is why we always try to professionalize the work with the trainings, with the constant meetings, the constant think tanks of how we can reach these individuals and provide and get them to be willing to accept the services that will help them have a paradigm shift in the way that they've been sort of ostracized from society, whether it be by their own choice or by them simply just buying into the fact that they somehow are antisocial and have developed antisocial traits. I've worked with pretty much everyone on the call that's a part of Healing the Hood. There's so many things that Advanced Peace is limited in doing in regards to individuals who may have drug problems, parenting problems, all these things the collective and the collaborative are able to address. And I want to close by saying that with our program being able to have a junior fellowship and a senior fellowship, we were able to work with Healing the Hood and really get out to a quick start and having that success of the 2 years, beyond 2 years of no juvenile homicides. And we would like to be able to continue this partnership and continue to do great things, even though we are heavily impacted by COVID-19 right now as we speak.
Great. Thank you very much.
Thank you.
Next, we have Barry.
Good afternoon, everyone, county board members and my great team of Black Child Legacy. Barry Axia's Voice of the Youth, a part of the Healing the Hood component with violence intervention and prevention. I just want to shadow out and again, give all, celebration and credit and due to all of us, because we had 0 homicides of youth in 2018 and 2019. Though we're in a moment where the youth homicide is up, we have to understand with this proper investment, this collaboration, that not only fields bigger organizations, but smaller organizations like myself with Voice of the Youth that might be more boots on the ground and more in depth into some of the trenches of some of these areas. What Black Child Legacy gave was an opportunity. What you guys did as of the Board of Supervisors is allowed opportunities to be given to those individuals and those organizations that do the work that some people have not seen at a larger scale, and giving them the opportunity to touch young people and touch families that are usually not even served or touched. So I look at this investment, this cooperative way of us building and interacting and not continuing to be worked under silos is a great moment. And the idea of thinking about how we will change the dynamics of what our population deals with the dysfunction and the trauma and the poverty and the pain. I look at this investment as a needed to be long-term, because we're dealing with long-term effects of decades of trauma, decades of poverty, and decades of pain. This is not something that we could fix within 10 years or even 20. We're looking at long-term scale solutions to advertise a new idea of what Blackness looks like for some of our community members who don't see Blackness as being excellence. I see their Blackness as being a debt to society, a detriment to their own way of living and thinking. So I say this in part to understand that we all come as seeing everyone as deserving a right to live and breathe and work as hard to obtain what this country is here for. I feel like we continue to jump over these hurdles. When you guys made that resolution to declare racism as a public health crisis, this was one bigger step into the ideas of really looking at actual change that is sustainable. We're not talking about change that's for only the moment, but we're talking about sustainable change that can be continuous. If we do not invest in the ways that we have, you'll see the murders spike back up to where they used to be. You'll see a different direction. So in order for us to continue to move through this pandemic, to do the work that we need to do as soon as this pandemic is away from us all, because we're all reeling in some kind of way, we will get back, as I can almost guarantee, to the 0 homicides that we had before. And it won't be 2 and more years. It will be a continuous years of not seeing youth dying, because we will be able to support youth with opportunities. And I feel like the opportunities a lot of us were given in this programming that we were not able to get before Black Child Legacy is the opportunities that we now need to give to our communities. An opportunity that's not going to leave them after 3 or 5 years, but an opportunity that we can pass through generations without the trauma. Thank you very much.
Thank you.
Thank you. Next up is Tina Roberts.
Good afternoon, commissioners.
Good afternoon.
It is so wonderful to be able to speak with you all today. I am representing Roberts Family Development Center, and we are with the Incubator for Del Paso Heights, North Sacramento. But you have seen the data. So what I want to talk about is from my hat as a steering committee member. I actually started out with the Blue Ribbon panel and then went on to be a steering committee member, which I've gotten to see the idea go from an idea to on paper to action. And it is just, I feel for the first time in a long time, really optimistic about what we are trying to do here in Sacramento. And I think what we're trying to do here in Sacramento is actually have an impact on systems and to change policies that will benefit all of our children, all of our families. And how much better will our county and city be when we can continue to have those positive impacts on our families? Because that is our ultimate charge, is to make sure that we are providing our families with the best quality of life that we can possibly do. And I think that all of our incubators have done that in such a wonderful and trusting way. And as our fierce leader, Kendra Block Montgomery reminds us, this is not not a moment, but a movement. And so we are impacting all factors here in Sacramento. And I tell you what, the country is watching us because we're onto something. We are understanding that without resources, our families, they have a hard time connecting. But we can take resources and invest in our families. And then we get that return from that investment. So I am looking forward to this continued investment. I'm looking forward to this continued partnership. And this has been some of our life mission for 30 plus years. So as I said, I'm feeling extremely optimistic and just look forward to the future. So thank you, thank you, thank you.
Thank you, Tina.
Thank you. That concludes all of the speakers that we have signed up to speak, and we have lost our callers. So I do not need to open up the phone lines.
Okay. Well, again, I just put something in the chat expressing what I feel sincerely about this work. It is work that not only should continue, I think we could all agree on that, but we should make sure that it continues to thrive. I think we need to, we've been all operating under the general auspice of reducing child deaths 10 to 20% by this year. As the outcome data show, we've exceeded that in some areas very substantially. But I think what it's telling me, at least, is that I think we ought not to be shy about how we move forward and set new goals for ourselves. Remember, this is an effort that has focused on the 4 leading causes of death. There are several other causes of death that are disproportional. These are the most, these 4 areas showed the widest disparity, but there is a tremendous amount of work, and I know you all know that, left to be done. And I just look forward to the time when we don't have to rely on Zoom for these meetings. We can get back to seeing each other in person and celebrating in person these tremendous outcomes. And again, as I put in the chat, to a person on the Zoom, You all have touched this effort in small or great measure, and it would not be successful without your partnership. So I'm humbled by it, and I'm thankful for it. And you should also know that tomorrow the Board of Supervisors will be receiving a very similar report. I would invite you all, if you're so inclined, to maybe chime in for round 2 of the celebration tomorrow before my colleagues and I. But again, just really pleased that in a dark time like we have now with COVID, that we do have something to celebrate. Any final comments by anyone? We said it all. All right. Okay. That was obviously a presentation. There's no vote involved with the report. So now we are on to commission member comments on anything that might be on your mind. Any commissioners have anything they'd like to share?
Commissioner Cerna?
Yeah, Commissioner Wirtz.
Just a quick announcement that I think fits into this great presentation we just had. I've had the privilege of working a little bit with the state office of the Surgeon General, and as of Wednesday, they will be releasing their report on ACEs, and I just want to highlight everyone to look forward to that. It's called the Roadmap for Resilience, the California Surgeon General's report on adverse childhood experiences, toxic stress, and health. And so I just think it will be a useful tool for us, and indicates in part some support that exists at the state level as well for these kinds of efforts to address toxic stress and root causes behind that. So just notice to everyone to be looking out for that.
Very good. Thank you, Commissioner Wirtz. Any other final comments from commissioners or staff? No? Okay. All right. The balance of our agenda is communications filed. And so with that, if there's no further business before this commission, I want to say thank you to all of you for spending a good portion of your afternoon serving the county of Sacramento, as you so faithfully do in your capacity as stewards of our youngest constituents. I do appreciate your service, and please stay safe and healthy.
Thank you.
See y'all.
Bye, everyone. Great to see you.
Bye. Thank you.
Bye, everyone. Merry Christmas, everyone.
Merry Christmas. Holidays.